Before I bring in Dr. David Brownstein, I want to talk to you guys about how you can support my work. Many of you all already know that you can go to AllisonWinePromo.com where you can get 50% off some of my favorite Malbecs from Argentina. These are high altitude, very remote, grown grapes, one from almost 9,000 feet, small farms, family operations, wines you can't get from the grocery store. And because they're small family operations, they're perfect for when you have your family over, arguing over whatever the news of the day is. You can actually agree on something, and that is AllisonWinePromo.com. If you're already a wine drinker, you've got no excuse. Go to AllisonWinePromo.com, get a great deal on some amazing wines. Like I said, 50% off the wine itself and 50% off shipping. Pairs well with pretty much everything. And that it goes again for the first time you've invited grandma over since the beginning of the pandemic, when she voted for somebody different or decided to take a shot you didn't, or whatever it is. Like I said, this is the thing you can agree on. AllisonWinePromo.com. Again, Malbecs from Argentina. The Rogue Malbec is my favorite. You see it here. It's from hand-picked grapes. They hand-pick the grapes. It's from almost 6,000 feet. And it's named not after my podcast, but I wish it was. It's pretty apropos, though, for the people that we're going to have on, including Dr. Brownstein. So we're going to get to him in just a second. The first thing I want to say is we are going to cut the YouTube stream short. So if you're watching this on YouTube, make sure that you're also checking out Rumble and ROKFIN, where we're also live. You can go to my locals community, which is also a great way to support my work, AllisonMorrow.locals.com. You get to be part of my editorial board and post questions ahead of time for interviews. We're going to do that too in the stream. You also give me story ideas, feedback, all kinds of good things. We have live editorial board meetings exclusively on locals on the weekend, so hope to see you over there. The reason I'm having Dr. Brownstein back on is he was actually, I think, the first, if not one of the first doctors that I ever interviewed at the start of the pandemic who faced censorship, not in his case from the FTC, or sorry, it was the FTC, not in his case from the big tech companies. It was the government that came after him. And that was because he was posting interviews with his patients on his own website. And they came after him and told him that he had to stop. So we're going to bring him in. And without further ado, how are you doing, Dr. Brownstein?
Happy to be here, Allison. How are you doing?
I'm good. They've removed one of our videos, but I think the other one is still up. So you live to speak another day. I remember the last time you were on, you said something like you wrote your book, which I'll just tell people ahead of time so they can see it here, is called A Holistic Approach to Viruses. And you can get it at drbrownstein.com. You wrote this book. I remember you're telling me that it's because your lawyer told you that books have First Amendment rights, but people don't.
That's exactly what he told me when I received a notice from the federal government, and the state medical board, a few days later. I told him I had to get a lawyer, and he said to him, I was writing this book about treating my patients during, this pandemic. And he said, oh, well, you got to finish the book. And I said, well, is that going to, they're going to censor that as well? He goes, they can censor you. They can't censor a book. And, that was a little shocking to me. But I did finish the book. And, I've written a lot of books over my time, and it takes two things for me to write a book. Either I have to be passionate about something or angry about something. And in the case of the pandemic, it was both all at once, and I wrote that book really fast because I had both emotions in me, at the same time.
Maybe we could start with what were you passionate and angry about?
Well, we're almost 3 years into it, right? 2023 will be 3 years. Things started in first report out of China was 2019, the end of 2019. And then, it came to the US around February of 2020. So, we're cruising on 3 years of this. And, the passion was that, when we're told this new novel virus is coming from China, and, the modeling estimates were that by the end of the year, over 1 million Americans were going to be dead and over 3 million infected. And, they were talking numbers of, huge numbers, huge percentages dying of COVID, from 1 in 3 to 1 in 10 people who get infected with this are going to die. And we all saw the headlines and the news feeds from, China and Italy and Spain, and the hospital wards full of sick patients, sitting in these beds, 1 foot apart from each other on ventilators, and the bodies stacked up, the cold trucks to collect the bodies in these countries. And they said, well, that's what's coming here. And everyone was scared out of their minds. And, you know, at our office, well, I mean, you know, the story came, you know, it came to Michigan in the Detroit area. You know, I'm in Northwest Detroit, in March of 2020. And, you know, the headlines were there. Everybody was scared. We were going to, you know, they were talking about locking down. And I remember vividly, it was about the first or second week of March. It was the end of my work week. And my office manager came to me and said, "You got to talk to the staff." And I said, "What's wrong?" And she said, no one's going to come to work next week. Everyone's scared. And so we had a meeting in our waiting room, and it was the Thursday before Michigan locked, you know, my area locked down. You know, the governor locked us down the following week. And you know, you could cut the tension in the office that day with a knife. You can cut the tension in that room with a knife, as everyone was just out of their minds, you know, with what's going to happen. And, you know, I asked my staff, you know, "How's everyone feeling?" And the first question that came to me at that time was, "When are we closing the office?" And my comment was, you know, closing the office. I said, "We know how to treat viral illnesses. I said, we've been practicing holistic medicine for over 25 years, nearly 30 years. I said, they call it the practice of medicine for a reason. We've been practicing for this very episode. I said, our patients don't get hospitalized, don't die from flu and flu-like illnesses like anywhere near the reported numbers. And consider in the US, every flu season from 20 to 100,000 on average, Americans die every year from flu and flu-like illnesses. Between me and my partners, we can't recall a patient ever dying from the flu. We can't recall a patient being hospitalized from the flu because conventional medicine doesn't have a lot to treat viral illnesses, but holistic medicine does. And there's many ways to support the immune system in times of crisis and times of need. And we've witnessed that in we developed a protocol to treat viral patients over 25 years with little tweaks to it and changes to it as we learn new things. But the basic core of the treatment was the same. And we find our patients, when they get sick with viral, you know, it doesn't prevent people getting sick, but it helps their immune system recover, because ultimately that's what you recover from when you get a viral illness is the immune system has to engage and react and respond. And that's how we were designed. We were designed with a robust and strong immune system to tackle viruses and bacteria and parasites. And if we didn't have that, we wouldn't survive as a species. So I found that using natural approaches can support the body. And you can look at how the immune system functions and figure out what inhibits it and what causes it to strengthen it. And so we were using this viral protocol, and I told my staff, "Hey, we know how to treat viral illnesses. And by the way, every year during flu season, 1/3 of the viral illnesses are coronavirus strains." Now, there was never a really good test for that, but that's what was reported by the CDC every year. So I said, I think we're well situated to treat this. And I said, we're nimble and smart enough in our practice that if it doesn't work, we'll figure out what works. I said, but we have therapies to offer. And I said, I'm not closing the office. My partners and I were in agreement with that. I said, no one has to work through this. I fully understand if you want to stay home. No one will lose their job if they stay home. But I'm working, and if I have to work alone, I work alone. And I'm working until either I get sick or they won't let me work. And we started seeing patients the following week. And I didn't sleep maybe the first week of treating patients because I didn't know if it was going to work. This was a new strain of coronavirus. But after the first week,
hang on, Dr. Brownstein. Can I cut you off for 1 second? Let me just cut you off real fast. I just want to give everybody a heads up that's on YouTube. Okay. We're going to go into in depth what Dr. Brownstein was doing. We're not going to do it here. And I'm sure I don't need to explain to everybody exactly why, but if you're interested in going direct with him, again, AllisonMar.locals.com. We're live on ROKFIN and Rumble, but I just want to make sure you all know so he can actually go in and tell you exactly what they were working on. Make sure that you're watching on the other platforms. Okay. But real fast, before you get into that, Dr. Brownstein, when you're talking about making the decision to continue working and like your employees are scared and everything, and then as you're doing this, like you're with your patients and, you're on the front line and you're like, here I am working hard. I didn't shut down. My employees are taking care of patients. What happens with the FTC?
Well, so I started treating patients, and during the first week or so, I wasn't sleeping. I was, I didn't know if they were going to survive. I didn't know if I was going to get sick, and I've got some of my own health issues that I'm not really good if I get a viral illness. And people were coming, they couldn't breathe, and they had all the symptoms of COVID-19, and pulse oxes were low and all that stuff. And we started treating them, and a few days, a day or two later, I was calling them every night. We were all calling our patients every day to see how they were doing. And within a few days, we knew we were onto something. The patients were getting better. So I started doing, I had written a blog for years, and I wrote about what works and what doesn't work in my practice and what I saw, occurring in the medical literature. And so I started posting videos of interviews of patients, and I would be the interviewer, and I would ask the patients, tell me, what were your symptoms? What did you do? And what happened? And I would be, I would lead the interview a little bit, but I was silent. I let them do the talking. And the ones who were very sick with COVID were telling the audience, their experience with it. And, I titled those interviews, There's Still Hope Out There, because at that point, there was no hope. At that point, if you got sick and you got sick enough and went to the hospital, there was a 80+% chance you were going to die. And everyone thought if they got sick, they were going to end up in the hospital and they were going to die. So I was posting these videos, and out of the blue, I got this warning letter. And I remember, when the warning letter came, that's dated there. We were treating these patients outside too. In Michigan, in March and April, and even the beginning of May, it's not great weather. It's cold. It's wintry weather. There's snow. There's ice. There's sleet. And we were doing these treatments a day, and then we were doing them at night. Sometimes working, 14 hours a day. So I had come home from work that day. It was a Tuesday night, and I walk in, I was exhausted, and we had worked late, and we were treating people outside that day as well. And we were doing these treatments with 50% of my staff, because about 50% stayed home. So I get home from work. I'm holding my bags in my hand. My wife and daughter are by this computer. As soon as I walk in, I see their faces, and I'm like, what's wrong? And she said, take off your coat and sit down. And I said, is everybody okay? And she said, take off your coat and sit down. And I just stood there holding my bags. And I said, tell me. And so she says, you got a warning letter from the FTC. And I said, I had worked at least 12 hours that day. And I said, well, the FTC, what's that? I said, the federal government, FTC? She said, yeah, the Federal Trade Communication. I'm like, what do they want with me? She said, you better sit down. And, she summarized the letter to me, and, we had to decide what to do at that point. They spent a lot of time on me and my site. There was it was 4 or 5 pages of single spaced and bullet points. And they were saying that there's no prevention, treatment, or cure for coronavirus. Therefore, any mention thereof falls in violation of this federal code. And I had never mentioned a prevention or cure for COVID. All I mentioned was I was treating people sick with a viral illness. And whether they had COVID or whether they didn't have COVID, at that point, there was no testing you could do. So basically a diagnosis of COVID-19 was, as an outpatient, was based on symptoms, because there was no testing available. The CDC had botched the testing at that point. So I made clear in those interviews that I gave that I was treating people with a viral illness, and, that fell in violation of that FTC Act that you're showing there. And so I took everything down at that. I had 48 hours to take everything down, or else I'll hear from the U.S. Justice Department. I hired a First Amendment lawyer to, help me through this and, give me some advice with this. And, but that's what I did at that point.
It says that in the letter, it's unlawful to advertise a product or service can prevent, treat, or cure human disease unless you possess competent and reliable scientific evidence, including, when appropriate, well-controlled human clinical studies substantiating that the claims are true at the time they are made. Somebody over in my locals community asked if they had let the CDC know that that's the rule because they advertise so much stuff, you know? So it's, especially like, the big, uh, Fauci ouchie, is that what we call it? Anyway, so I want to switch you over real fast for the YouTube crowd to this because I'd like to ask you what you think about this WHO, World Health Organization, this being called the pandemic treaty for the member nations. And, hey, COVID taught us a lot of lessons. Let's do better next time. If you go down to Article 16, which you can read a short write-up about in Reclaim the Net, which you see right here. World Health Organization meets to plot censorship of misinformation under International Pandemic Treaty. I'm going to go down to 16. It basically talks about how, we just need to be, they coined the term infodemic, and we need to be, really serious about surveilling misinformation. Here it is. Strengthening pandemic and public health literacy to inform the public, communicate risk, and manage infodemics. And then also conduct regular social media analysis to identify and understand misinformation, design communications and messaging to the public to counteract misinformation, disinformation, and false news. And of course, a lot of folks, rightly so, get concerned about this stuff because we've seen such extreme censorship on the tech platforms, not just, like Allison talking about stuff, but doctors like yourself who have had significant histories in this field. If you're talking about something that is deemed misinformation by the World Health Organization and thereby the pressured agencies at the United States or elsewhere, I think, I guess I would surmise that the effect would be increased pressure on those agencies to go after doctors like you. So increased pressure on the FTC, for instance, if that happens again, or increased pressure on YouTube, which says that you can't violate their guidelines by saying something that the WHO does not say. I mean, the WHO is basically like what YouTube says is the gold standard in healthcare. So I'm just curious, since you had crossed paths with this, the pressure of government agencies in sharing what you were doing. What do you think about this?
I think it would be great for the World Health Organization to control our views and our misinformation. I mean, I could, the only thing better than that maybe is have the CDC do it and the FDA do it, since they've done such a great job with COVID. All three organizations have really led us through this crisis in such fine form. Of course, I am being sarcastic here. We don't need the World Health Organization dictating to us what's misinformation or not, when they possess so much misinformation. The beginning of the crisis, I believe it was January of 2020. The WHO made a statement that their Chinese authorities have determined that COVID is not transmissible person to person, and therefore there's no need to worry about that. And you can find that on. I mean, look. Who's going to be the purveyor of misinformation? I wouldn't mind being on that committee because I'm on the ground floor. I was in the trenches, working through COVID. I can tell you what I saw was misinformation or not. Others might disagree, but, in the U.S., we certainly don't need the World Health Organization holding a guillotine over our heads and ready to snap it when they don't like what we're saying.
One other interesting part of this is is to strengthen research into the behavioral barriers of, and drivers of adherence to public health measures, confidence and uptake of vaccines, use of therapeutics, and trust in science and government institutions. So they want to know why people don't trust them. So they need to. I think that's a good. What they're going to do is censor more in order to. Yeah. They're going.
I think we should strengthen the research, and we should figure out why people are questioning things right now. And I think that's a good idea. But
I agree, actually.
I think that's a good idea. But I certainly don't want the World Health Organization dictating to me, what I can think, what I can say, and what I can do. And that's, we're supposed to have a First Amendment in our country, and it's the First Amendment for a reason, because it's the most important amendment. That if we can't debate and we can't speak our piece and we can't disagree with each other, then might as well be a totalitarian government.
Well, yeah, it seems oxymoronic to say we want to know why people don't trust us, but we're also going to silence any information that's out there that shows that they don't trust us? Like, how are you going to actually do the research?
Right.
Like I said, like, I agree with you that it would be great if it was done in good faith and they were truly genuinely saying, we want to understand like how we have perpetuated this. Maybe we've oversold certain things, or maybe we've even lied, or maybe, you know, we have financing that is put us, you know, in the crosshairs of having other intentions that may not be public health, you know, all those things. And like, people are rightly skeptical of what we say. Typically when journalism is studied, which is my previous industry, that's not the takeaway. You know, the takeaway is usually something else, like a person, they blame it on a particular political figure, or like something else, you know, that they don't usually look at themselves and say, oh, you know, crap, you're right, like we did get this wrong and that wrong and this other thing wrong, and so we understand. It typically isn't that, but I do think it's very odd that you would say we want to understand something better, but the very people we want to understand, we want to silence. How can you possibly understand somebody that you're silencing? Does not make any sense to me.
And if you want to understand it better, call me. I'm happy to talk to anybody. I have got some ideas on why people are distrustful of the U.S. federal agencies and the World Health Organization. And look, if COVID didn't bear our poor response to, you know, what happened, then I don't know what to say to that. You know, I don't think anyone's happy. I don't think the federal government's happy. I don't think the people are happy. I don't think conventional medicine's happy. And I can tell you the holistic side of things, we're not happy, you know, of what happened. And, you know, this, you know, early treatment was what we should have done. And, you know, we eschewed, I'm not sure how to pronounce that word, but, you know, we avoided early treatment. We were told there's no early treatment, stay home, stay at home. You just stay at home till you can't breathe. And if you can't breathe, go to the hospital. That's what the powers that be said. That's a disaster. That was a disaster. There's a lot of blood out there that are in people's hands because of those ideas. And we should be able to talk about those ideas, and we should be able to discuss them and figure out what we did wrong so it doesn't happen again. And I'd be all for that. But I'm not all for that from the World Health Organization managing that. We need to do that in our house first.
Davina Duckworth, it's weird how people don't trust organizations who lie and persecute them. I know, it's very odd. I don't know. I can't figure it out. Okay, before we cut the YouTube stream, tell us about what happened when the FTC stormed into your office. Maybe is stormed a strong word? Should I just say walked?
It wasn't the FTC. It was a state board of medicine. And,
State board of medicine. Okay, yeah. Please give us the update.
So that was about a year ago, and you know, they came and, you know, demanded to see what we were doing in our daily business, and it was very stressful and very, you know, and it was in the middle of my day, and you know, I told my staff, who was all in an uproar over this, you know, when they were in the waiting room, that we didn't do anything wrong. Just we'll let them come in. We have to let them come in. You know, I had a lawyer tell me that, you know, from what they were looking for, and I said to the staff, answer their questions, yes or no. Don't lie. There's nothing to lie about. We didn't do anything wrong, and that was a year ago. That was not a pleasant time in my medical career. Stuff like that makes me want to retire.
Yeah, no kidding.
I still like practicing medicine, but I'll tell you a little more of that, and I would still, you know, I do think about retiring when stuff like that happens. When I get that letter, when I get, you know, the board of medicine, you know, banging on the doors and all that. But we're getting through it.
Okay, just so everybody knows, again, we are live on Locals for a live chat. We have a live chat going on Locals. It's where you can support my work, $5 a month to post questions ahead of time for interviews like Dr. Brownstein. So I'm going to throw some questions over to him right now. We're also live on ROKFIN and Rumble. So if you're watching on YouTube, we hope to see you there. Don't forget, you can check out Dr. Brownstein's book, A Holistic Approach to Viruses, at drbrownstein.com. And we will see you over on ROKFIN and Rumble.